Okay, when you are out there presenting your services, I want you to understand a few of these quick techniques I want to be able to give you. I want you to make sure that when you create your presentation, you're presenting for that particular physician, for that particular referral source. Do not create a presentation about diabetic patients when you're trying to present this to an ortho physician, an orthopedic. You want to be able to be disease specific. And you, by you asking these physicians, or you by knowing what their specialty is, you want to create a presentation that will target the major demographics of patients that those physicians are taking care of. Let's say you're talking to a physician and they work with a lot of patients who are taking Coumadin or warfarin, and they would require PT-INR tests on a routine basis. Maybe you can actually explain to them how all your nurses are actually equipped with INR machines, that they can actually obtain the results as early as possible, so that those physicians can be told and can be aware if there are any changes that can be done. If there are any changes or new orders in regards to the medication dosage, you can actually have time to order those new medications from the pharmacy. This will make sure that your patients are being compliant with the medications that are being ordered for them. And other than just doing your presentation with these physicians, that moment that you're making the presentation, you can continuously send them educational-based marketing that shows them how your agencies provide services. When we are able to get a new referral source, or we're trying to get a referral sources in the past, we don't just hit them one time with our marketing practice. We literally continuously market to them in a weekly basis. Whether it's any type of contact, whether it's an email, whether it's a fax, whether it's a snail mail, whether we're dropping by, whether we're sending them a fax. And if you send them a fax, make sure you have authorization to send them a fax. You want to be able to be on top of their mind all the time. Another thing you should do is this. Don't be scared to ask for referrals. What I actually do is, before I even create a presentation to a physician, before I even start, I stop and I ask for a referral beforehand. I will literally stop and talk to that physician and say, look, before we start this presentation, doctor, I was hoping and thinking, would you know any other person or any other physicians that would rely or that would need the services like ours? It is not a problem to ask these questions. Don't be scared. Don't be worried to ask this. If you don't ask, you will not receive. If you ask, you'll be surprised how many of them will actually give you an answer. And if they give you a referral, you can create that great presentation, and at the same time, and ask them if they can actually talk to that referral, that the person they referred you to, and to give those people a heads up about you. Ask for those referrals. Don't be scared. You need to be able to be very persuasive. And we actually will go over in a different chapter, in a different video series, about persuasion and influence techniques during presentation, when you're presenting, when you're speaking to them face-to-face, or when you're talking to them in the phone. So that is a whole other video series. But one thing you should do is that you should be able to know how to persuade them if you are trying really hard to get them to refer a patient to you, or get all their patients. Sometimes just ask them to let you prove yourself to them. Look, let me talk about an 80-20% rule. This is the 80-20 closing technique, that no matter what I've done, I will normally get an answer from the physician. This is how the 80-20 rule goes. Okay, doctor, look, I am here not to ask you for all your patients. I just want to be the person to be able to give you the opportunity to use our agency. I'm not asking for all your patients. Give me 20% so that I can show you how amazing, how great our services are that we have. So in addition to that, by you giving us those referrals, that 20%, you're going to have two companies working really hard for you. My agency, where we're going to work hard to take care of that 20%, to provide great care to them so that we can get more patients. And then another thing is this, the other agency will work even harder because they are noticing that they are getting less patients from you. So you're going to have two agencies working really hard to get more referrals or to keep the referrals and not lose the account. Either or. Your life is easy and your patients are going to be given great care. And no matter how or what you're doing, ask for referrals. Don't forget to make sure that when you service them, when you create these presentations, you tailor it to their specialty. And make sure that you watch our video series on persuasion and influence techniques on how to be able to present very well and to start allowing these physicians to use your services. Now, on the 80-20% rule that I gave you, this is why we do it. The reason why we use percentage is because of this. You don't want to give a specific number on how many numbers or how many patients you want from that physician. So remember, laws of attraction. You ask, you get. If you ask to prove yourself with one patient, guess what? He may just give you one patient. And worst of all, he gives you the worst patient that he ever has to try to test you out. So if you fail on that one patient, you just failed entirely. So don't just ask for one patient or a specific number. Ask for a percentage. And also make sure you prove yourself, because you don't want to just take care of that one patient and mess up and you look bad and you never get referrals. Look, now that he gives you an opportunity, when he gives you that opportunity, make sure everyone's aware, your staff, your office, your administrators, let them know that you actually acquired this new physician and they're trying you out. Make sure you speak to the nurses, the therapist. If you're contracting some of your services, you contact them as well. Make sure that everyone knows that this is a new referral source and they're actually trying your company out. Now, obviously, I expect you to provide the same amount of service with every single client that you have, whether it's an old referral source or a new referral source. But understand, you need to prove yourself, so you may have to work a little bit harder. You as a referral generator, you as a liaison, a marketer, administrator, you may have to work a little bit more and help out with the services. So make sure that that physician is aware on what's going on. Make sure the family's happy and making sure that that patient stays in their house and not back at the hospital. Look, you need to do everything that you can to make sure that you take great care of your patients, of their family, of the physicians, of their secretaries. Everybody needs to be taken care of, because that is your goal. As a person that's going to be generating more referrals, as a person that's going to be a rock star marketer out there, or a rock star liaison or owner out there of a home health agency, your job is to make sure that you please everyone. Now, understand you can never please everybody, but you need to at least try. Okay? You need to make sure you try.